a recovering drug addict who is now motivational speaker. Abner Mariri joins us via our Skype line just to talk about the impact and the effect of drugs. Good morning to you, Abner. Firstly, what's your reaction when you hear stories of what has happened with these teenagers in KwaZulu-Natal?
My heart really, good morning, and good morning to your listeners. My heart really bleeds for them and their families, young lives being snatched out prematurely. And for me, it's just a travesty. It's a tragedy with the extent and the amount of what drugs have done in our society. And really at this difficult time, I'm sure that no one goes out to a club expecting to come back dead. And my heart and prayers are with their family and their loved ones in this difficult time. It's not easy to lose a young one, particularly snatched by this dreadful disease called substance abuse.
When we look at drugs in particular, especially in South Africa, Abner, mostly in informal settlements and also in townships, we see different variations of drugs that are being concocted. How do you actually place as a society the changing face of drugs and what is going into these substances?
You see, I think, and I'll answer your question, but I think the same intensity with which we've given HIV/AIDS and fought it relentlessly and galvanized every facet of our community to rally together to fight this scourge, I think is the same intensity with which we should look at this particular problem. And it is no respect of person, no respect of race, no respect of community. And I think we should be vigilant. We should be agile in making sure that we come together to fight it. You know, every person from every community, there's nobody in this country that's not affected with drugs. And for me, it pains me that, yes, and I can see that the government is doing something, but it should not be the responsibility of government only to do something. It should be a collective responsibility. We should have the same gusto with which we fought HIV/AIDS and to reduce the statistics that were upon our people, and we should do the same thing. And I think in doing that, we can make sure that we heighten awareness. I'm a recovering drug addict myself, so I speak from experience, and I understand what families go through. I understand what communities go through. It is not an easy thing. I understand even what recovering addicts are going through. Because when that craving hits, you want to do anything. You could steal even from your mother just to get a fix. And I think if we work together, and we must remember that this thing is just a disease and it has to be treated as such. And therefore, we must rally every single person in a community, functioning individual in a community, to make sure we can partner together to fight this scourge.
Abner, oftentimes one of the reasons mentioned, especially by youngsters, in terms of why they started taking drugs, it is often just begins as something experimental, and often people are not aware of what substances have been put in the particular drugs that they're taking. I mean, as a recovering addict, what are the measures that you've seen drug lords perhaps resort to in order to make their drugs cheaper?
Yeah, you see what they do. The drugs are becoming cheaper. They're becoming potent. They're looking for new markets. And what it will happen, and by the way, for every kid out there, nobody thinks that it will happen to them. Nobody thinks that they will eventually become an addict, because they think they're bigger than that. And the minute you start, you will never stop. You know, in rehab, I was taught 1 is too many, 1,000 never enough. And if we are not careful, and that's how it starts. It starts with young people thinking they can experiment, they can try this and this, and before you know it, somebody is hooked. And what drug lords are doing, they are making it even more cheaper, more potent, so that more people can be addicted, because if you've got more addicts, you've got more customers. And what we should do, we should disseminate information at schools, at various communities, at any single gathering that we can find. We should make sure that we disseminate information and raise awareness and heighten awareness, and also share what it is that we can do should somebody be addicted to drugs, what it is that we can do, especially in depressed communities where information education is very minimal and there is not a lot of support. You know, I've made it a habit of mine to go to rural areas where people don't have access to anything, to talk to young people, to try and assist them. And you'll be surprised what they don't know about drugs.
Abner, not everyone in society is necessarily opposed to the idea of taking drugs. I mean, is there such a thing as safe drug use?
Look, there is no, for me, there is no such a thing. At least I'd like to believe there is no such a thing as drug use. But we know young people will, even in the face of information, will try and experiment. So we come up with systems and ways of saying, if in case you are going to try, these are things that you should do. Number one, don't share needles with anyone. That anybody who's a stranger to you. We don't encourage to use drugs, but young people will try. But don't share needles with strangers. If you are in a club and you've ordered a drink, and by some sheer coincidence you go to the restroom, don't come back to the drink because you don't know who put what in that particular drink. Rather dump it, order it, or take it with you to the loo. Because there are vultures who are preying on our young people in clubs, who are spiking their drinks so that they can get high, get them hooked, and get them on the street. So if you go to clubs, there is no such thing as safe use, but make sure that if you use with people that you know, so that at least collectively you can, if somebody passes out, you can pick up a phone and call somebody that they know. Otherwise, if it's people that you don't know, my God, God forbid what will happen to that individual.
All right, that's where we leave it for this morning. Recovering drug addict Abner Mariri, certainly an issue that needs much more awareness in our society as we look at what has happened in KwaMashu in KZN.